Hi, welcome to your checkup. We are the patient education podcast, where we bring conversations from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Ed Dulesky, a family medicine resident in the Philadelphia area.
And I'm Nicole Rufo. I'm a nurse.
And we are so excited you were able to join us here again this week. You enjoyed yourself quite the day, 2 days ago when this comes out. You had a great Saturday.
We had ourselves a day.
We did. Why don't you go ahead and tell us a little bit about your experience?
Well, for my birthday, Eddie got me a visit to one of those head spa things.
For someone who doesn't know what a head spa is.
Well, it's probably the greatest thing that'll ever happen to you because it was the greatest thing to ever happen to me. And you're laying down and it's basically like when you're getting your hair washed like at the hair salon, but times a million.
Wow.
And they have that like halo, like what's it called? A hose? I don't know. That seems drastic to call it a hose.
Okay.
To like pour water over you so it gets like your whole head at the same time.
Wow.
And then they're like scrubbing you and using all these tools. And it's cool because they have this like microscope probe thing that they put on your head before and after. So
Yeah. I didn't see any of it, but this looks cool.
Looks like, so that was cool because the whole thing is about like your scalp health and like blah, 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 blah. But it was actually crazy because before you could see, like I had washed my hair the day before and you could see like my scalp was kind of dry and there was some product buildup. And then after it was like squeaky clean.
Wow.
It was crazy.
Did they just do the scalp or were there other things involved with this experience?
Oh, yeah. It was a full, I don't know if they like accidentally gave me an upgrade because I don't think that this was included. But so she's like doing the thing and then they put this steam thing over you. I'm not doing a very good job of describing this, but it's fine. But then she started rubbing me. She gave me a whole like neck, shoulder, upper back, arm, hand, like finger massage.
I didn't know about the finger.
Well, yeah, I mean, they get in your hands and then, you know, like when they like pull your fingers, she did that. And then she brings out these hot stones and does that whole massage all over again with the hot stones. And I'm like, oh, okay.
Yeah, this wasn't a slouch either. Like, this was a whole hour.
Yeah.
Well, actually, it was over an hour.
It was probably like an hour and a half.
Yeah, it was definitely more than an hour, which kudos to them. I'm glad they took care of you.
Oh, it was so great.
I'm so happy you had a great time.
And my hair really does feel like so smooth. Even like, so I like styled my hair yesterday and then I worked out today and was sweaty and it's still like so smooth and clean feeling.
Did they use any product in your hair to like treat it at all? Or this was just from like them?
I mean, I don't know what they did other than just using like shampoo when I was back there, but then she put like a leave-in product before I left.
That's awesome. Wow.
Yeah.
So you loved that.
I loved that. Gotta go back. I think you would like it.
No, it's, I mean, like,
there was a guy there when I went back.
I mean, yeah, who wouldn't? I mean, this isn't, why not? I did. I saw there was a couple there. Oh, and then this other guy came in, like a similar situation.
Except not similar. Okay, so Eddie got this for my birthday. So like he was paying for it and then he like took me down there and then just stayed and waited for me. And then he said that there was, I guess, similarly a couple that came in and they went up and what did he say? You say it. I wasn't there. You were. Yeah.
He was like, she sits down and she's going to get the treatment. And then, I don't know, there seems like to be like a little tension in the interaction. And then he goes and turns to the lady who's at the counter and he's like, yeah. I'm going to pay for half of hers. And I'm like, go all the way if you're going to do a gift. I don't know. I thought, and then he left. Now I thought he was in a cozy, it was like this couch that I was sitting on. And I thought he was going to cozy up next to me on the couch and we were going to make like most micro talk possible. Cause I could talk to a brick wall probably, but he left. So then I sat there and did some other stuff. Got ready for this episode actually is really what I did. But that was awesome. And then I did have you walk back. By the time you realized that we were walking back, we were almost already there. So that was clever on my part. And then we went to dinner. By the time we went to this restaurant last time, we weren't doing this. We didn't have the podcast. It was Soraya, and I'll say the proper name here just because for anyone who goes Suraya. For us, it was touted always as probably the best meal.
Every single penny.
Yeah, we've had. There's a tasting menu that you have to go through. They give you a few different options. It's Lebanese food.
It's so good.
Yeah, there's no shortage of food either.
No, you get so much food.
Tabbouleh.
Well,
obviously tabbouleh is a food, but I took my interpretation of the word of tabbouleh to mean throw my hands up in the air, sit back, unbutton the button, go one loop on the belt buckle further. I'm cooked. I'm done. I'm full. Tabbouleh. Obviously, that's not what tabbouleh means. And if anyone is Lebanese who's listening, thank you for the use of the word. But tabbouleh, that was so good. What was your favorite one?
I don't know how to say it.
Well, describe what the dish was then.
I can't even describe it.
It was
there were chickpeas in it, and it was amazing.
It was
that's all I have to say.
And it was fata.
Yeah. Fatteh.
Yeah. I pointed to the things on the menu when I was pronouncing them. There's no shame here. And then the branzino is the thing that we've had
still the best.
Yeah, we've had a bunch of branzino around now since then, just because I'm interested, and I'm like, oh, all branzino must taste like this. Not true. No, they're not like Soraya's branzino. And their lamb kebab, which was absolutely delicious. I literally thought I was going to get little hunks of meat on a stick. No. Well, they actually did have a tube-like shape to them, but it crumbled. It was so tender. It was all incredible. We were sitting at the chef's counter, so we could see the
HBIC chef.
Yes.
That was actually kind of cool. Because they had the two HBIC chefs, and then I guess they the cooks are making everything, and then those two guys have to approve everything, and they put the garnishes on with their little chopstick looking things, and they place everything meticulously on the plate, and you watch them do it.
Yeah, it's awesome. There's a couple I think the menu, and I guess we haven't watched the bear, but people are more into.
Oh my God, people were saying yes, chef.
The life of a chef,
and the HBIC chef.
Yeah, which is crazy. It was cool to see. It's I guess it's a first name. As when they address it as a title, it's not hi, Dr. Dulesky, and it's no, yes, chef. It's kind of anonymous almost.
Yeah,
you're just one of the chefs. You have become one in the community. You are chef, not the chef, right? There's no article in front of it. It's yes, chef. Can I get a yes, chef?
Oh my God.
Come on, give me one.
Yes, chef.
So then there was I was absolutely full already, and then obviously our server was incredible. He was so kind. I probably had no shortage of. Well, there's little 8-ounce glasses of water, and I'm surprised they just didn't put the pitcher in front of me.
I know he came by every 7 minutes to fill up Eddie's water glass.
Yeah, oh my God. And then there was a thick cheese to top it all off. If there was an ice cream based dish, that would have been awesome.
Yeah, I guess that was a more traditional Lebanese dessert
with the savory cheese at the end.
Yeah.
But all in all, I can't. This place is amazing. It's so tasty, worth every penny.
We have to go when it's nice out, because on the back patio situation, I think I'm told they have a different menu out there.
Yeah, and I've heard, we've talked about this outside of these, when we have a billion other conversations outside of the recorded ones, that they have the brunch that we'd like to go to. Some of our closest friends were supposed to go there, but I guess they flexed to a different place last minute. And no, that place was awesome. Our intern is here for all those who are worried. He's floating around licking a lick pad. He's getting ready for the Super Bowl. By the time this comes out,
Sunday.
By the time this comes out, someone will have won, and a lot of our audience is in Philly, so I'm not sure what it will look like, but here we go.
I'm excited to make the buffalo chicken dip now. We were in a conundrum, and I was kind of upset earlier because I didn't plan everything ahead. I had everything else to make buffalo chicken dip, but we didn't have buffalo sauce. We were out and about yesterday, so we went this morning And shockingly to nobody, there was no buffalo sauce anywhere in the city. So then I finally came to terms with that. We just were not going to have buffalo chicken dip. We had these other things to have while we watched the game and have a Super Bowl Sunday. But then I remembered that we live in an ingredient household. And it turns out that we have all of the ingredients to make buffalo sauce. So that's actually what I'm going to do after this.
Yeah, this is awesome. We, I mean, it was the one thing I asked for. I did not like, there was no shame. I wasn't going to throw a hissy fit, a tantrum about buffalo chicken dip. Perhaps it would come later in the week. I mean, we got great Valentine's Day planned. I mean, we could just chit chat all day long. Yeah. I know that the people came for. I'm so excited for this, like literally from scratch.
I hope it's good. I think it'll be
buffalo
good.
Chicken.
But I just love that have gotten to the place now for a while where like, if we don't have something, I just make it. Yeah. Because we have the things.
That's awesome.
And that's the perk of living in an ingredient household.
I really never heard of it called an ingredient household before, but.
Oh, really?
No.
People are like, did you grow up in an ingredient household, or I guess a meal household is the other? Where like, do you just like have things to like make a meal or make food, or do you have like, had a big weekend, lots to talk about.
Had a big weekend. Happy birthday, Chloe. I'm not sure if you're listening, but
she better be listening.
Hope so. Those Vermont beers were delicious. I can't get enough of that. But it was nice to get some of the crew back together and have a lot of laughs. Definitely about topics that will not be discussed.
No, certainly not
on this podcast, but maybe other podcasts, clearly, because that's where the ideas were coming from. All right. So maybe it's time.
I think so.
Our intern just joined us for the actual content. So, Nick.
Ed.
What are we going to talk about today?
Well, we're continuing our cholesterol journey and talking about treatments today.
Yep. Today we will talk about both lifestyle and medication treatment. So big meaty episode if it wasn't meaty already. Treating cholesterol is incredibly important. And like Nick said, we're going to talk about high cholesterol again. We're going to talk about LDL cholesterol, focusing on that. Maybe some triglycerides and what medicines are out there to do that as well, or what lifestyle changes, and how these increase the risk of heart attack, stroke, and other cardiovascular diseases, which we defined in previous episodes. Feel free to go back and listen to those to catch up. So I guess the first topic of conversation is, when is treatment for high cholesterol needed? So at this point, it's an individualized decision. It is a case-by-case basis. There are different recommendations made by different societies, and there are a lot of factors to consider, especially current lipid levels, particularly LDL cholesterol and triglycerides. Well, people tend to think about the presence or absence of cardiovascular disease itself. Someone's individual risk of developing a cardiac event goes into this discussion. And other risk factors as well, like if someone has diabetes and they're over 40, people are thinking about a medication. Or if they have high blood pressure, it contributes to your risk, and maybe it's time to add a medicine to treat cholesterol. And so there's also patient preference. Like, I've had multiple conversations in this past week with people who were in a like medium risk, and otherwise stated like borderline or intermediate risk. And it's a conversation about how to manage cholesterol. So determining who gets treated is one thing, but then there's another thing to consider of how aggressive are you with treatment? And so people sometimes have more aggressive goals when it comes to people with cardiac disease already, if they have diabetes, or something called familial hypercholesterolemia. What the heck is that? It's a genetic condition where like everyone in the family or anyone who's affected in the family has really high cholesterol. Those people get more aggressive treatment. Basically what I'm trying to say is there's a lot of factors that go into it. It's that conversation that you have with your trusted physician or whoever's taking care of you to decide whether you medicate or not when it comes to your when it comes to cholesterol. How's that sound?
I think that sounds great.
Okay. So why don't you take us a little bit through, it's a really like people, I don't know, people get really excited. Well, not excited. People as doom and gloom, actually. Like they get the lipid profile. They're like, oh my God, why is my LDL high? And then they're just kind of waiting for the medication question. And or they're going to be told that they have to take the medication.
Mm-hmm.
But if someone wanted to think about all the things that go in their body and everything they do in their life, what things can we do to actually, lifestyle changes to lower cholesterol?
So there are 3 specific lifestyle type changes. The first is, are the dietary modifications. So reducing your total and saturated fats, limiting refined carbs, excess calories, and alcohol. So increasing fruits and veggies. I guess there's some evidence to show that a plant-based diet can lower your LDL cholesterol, which is the bad one.
Yeah, that makes sense. If you're just taking in less fat, then your cholesterol will likely go down. So when it comes to doing stuff like this, we've talked about calorie inventories before. I've recently been starting to talk with patients about fiber inventories, that you have to assess what's going on in your diet. So if you're going to be serious about this, maybe you get an app. We don't have any specific one to recommend, but a food counting app, and assess what actually is going into your body every day, and take a saturated fat inventory.
Yeah.
Instead of counting calories, like some people count sodium. You see how many grams of fat are in your food. And if you want to be serious about this, find it in where it is in your life, right? Because it's you're going out and purchasing this stuff. It's in the house somewhere, or you're going out and buying this food. So what else can we do with dietary?
So we have dietary modifications and then exercise. So regular exercise is beneficial. And then the third is weight loss, which should hopefully just come naturally with a dietary modification and exercise.
Yeah.
Yeah.
And
so I would say, not that I know anything, but I would say the dietary modifications are probably the biggest one.
Yeah, I would say
right,
so.
Because it goes into what you're putting into your body.
Totally.
And what you have put into your body for the last however many years got you to this place.
Right.
Most likely.
And it's not too late.
Yeah.
And I feel like sometimes there's some apprehension when it comes to going to the doctor, and some of this is baked into the knowing the unknown. If you don't know what your A1C is, if you don't know what your LDL cholesterol is, if you don't know what your cardiac risk is, then maybe it doesn't exist. And that's not true. Mm-hmm. And I try to be as welcoming as possible. I know maybe that's not everyone's experience, but you should go get checked out. Go get checked out so that you can find out what things there are to work on. Because especially if you're at a certain age, there are risk calculators that can be used. You can adjust these risk factors. If maybe we need it's a yellow flag up in your lifestyle, and hey, that burger every week that you're getting from Five Guys, maybe it can't be every week anymore. Maybe it needs to be once a month. So these are they're important because truthfully, when I sit with a patient and I talk with them, it ends up being I talk with them a lot about medicine, but I really try to impress upon them that that's because that's the time that we have, and we have time to make decisions and answer questions. And that's why we do this episode and we do this medium, so that we can talk about these lifestyle changes, because that's the first thing. You should take a beat and take 6 to 12 months and reflect and say, is there something I'm doing at home that I can change?
And the answer is probably yes.
And the answer is probably yes. And you just have to be honest with yourself and reflect that
yeah. Because most of the time, if your LDL is high, it didn't just happen.
Mm-hmm. It's not because you ate that day. If you go get it in the afternoon and you had lunch and you had dinner, that one's not moving. Triglycerides maybe. But this is stuff that happens over time. And it's not too late. The answers are within you. And you just have to get ready to make significant changes in your life when you're ready. Okay.
And if, maybe you don't want to make those lifestyle changes, or maybe you do and it's just not working. And there are some medicines, right?
Yep. That's a professional. That was a professional.
Yeah, you like that?
I like
That's
that.
Good.
So, like you said, very specifically, if the lifestyle isn't working, or just if you have certain disease, it's time to think about a medicine because your doctor or nurse, physician's assistant, whoever's taking care of you is saying it's time to start thinking about medication. And the number one medication we are going to spend the most time talking about, because this is directly going to lead into our next misinformation episode, because there are people out there slandering these great medicines.
Oh my God. Yeah.
Is the statin medication. This goes by the name of rosuvastatin, atorvastatin, pitavastatin. They all have brand names. We're not going to go into what those, we're talking like Crestor or Lipitor. Those are the brand names of the most common ones. Sorry, I was just.
There's a whole community of ill-informed people on the internet who are strongly against statins. And it's actually crazy.
We got a message from your mom about this lady who's out here just she's one of these homeopathic hoo-has who we have no idea what her credentials are, but she's on everyone's screens talking about statins. And so what we're going to do is we're going to break down at least this medication and probably a couple others. We are going to break down their effect and the side effect, because when we talk about medications in general, when a doctor mentions medication, nearly the first word out of someone's mouth is, what are the side effects?
Yeah. But what is the side effect of your high LDL?
Exactly.
Death, probably.
Heart attack, stroke, peripheral artery disease.
Yeah.
Exactly. Yeah.
So what do you want?
So
which one?
So what it can't be lost is the effect. And what is the effect? So we'll start here. Statins are the most commonly used and most effective medication for lowering LDL cholesterol. We've defined that all over the place. That's the bad cholesterol. And this is how I describe it to people. I usually don't tell them that it just lowers their LDL. This medicine prevents heart attack, stroke, and death. I say it again. Statins prevent heart attack, stroke, and death. They lower LDL by about 25 to 55%. And it's different in different people. And they also lower triglycerides some. How they work is that statins work by decreasing cholesterol production and increasing its removal by the liver. We won't get any more complicated than that. But they are very simple, affordable medications that have been around forever. And that's the effect. Let me say it again. Statins prevent heart attack, stroke, and death.
Yeah. And before you say that it's just a ploy from big pharma, blah, 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 blah. Like you said, they've been around forever. They've been generic for a long time. Mm-hmm. They're not expensive. Mm-mm. This isn't some specialty med that big pharma is I'm sure they are making money from, but it's not like these other crazy expensive meds.
Right. So that's the effect, and it's so important. And these medicines, for some reason, people, and I see here, because we're going to talk about them. We're going to talk about these side effects. We're going to talk about the ones that are rumored. We're going to talk about the common ones that we all counsel people on, but the ones that are out there and need more context, because otherwise they just get a headline of statins cause this, and there's no context. There's no information. There's no data. You're getting that today. So you think that it's reasonable to move on to the side effects, I guess?
Yeah. Let's talk about them.
Well, the top line is that statins are actually very well tolerated. Shocking. People oftentimes just take these medicines and nothing changes at all. Mm-hmm. They don't feel any different. They're just now taking a medicine, which may be a lot different for people. There is something as pill inertia. You go from 0 pills to 1 pill. That could be a big deal for someone. But the side effects do vary in frequency and severity. So the first umbrella of side effects are statin-associated muscle symptoms. This is the most common one, and this includes something called myalgias. Myalgias are muscle pain, and with a normal lab level. Sometimes we have to look into the labs if people are having muscle pain. But how often does this occur? 1 to 5% in the clinical trials. In real life, 5 to 10% maybe. So that is 5 out of 100 people. Flip it. 95 people out of 100 don't get muscle aches.
Mm-hmm.
So sit with that for a second. Like if you're going to...
And honestly, all right, let's weigh it again. Muscle ache, heart attack. Muscle ache, stroke. Muscle aches, dying.
There you go.
Like...
Yep. Even more rare than those, sometimes the muscle aches can be associated with some elevated, what's called a CK level. And that goes into a inflammation of the muscles. And then less than 0.1% of the time, it is 1 in 1,000 people, 1 in 1,000 people have very high CK levels in something called rhabdomyolysis. Extremely rare. Extremely rare, but that's why these are prescription medicines. And you can't just go to the pharmacy and pick them up like Tylenol or Motrin or Advil. So the next side effect I'd like to talk about is liver injury. Again, this is why this is a prescription medicine. It is extremely rare. The risk of liver failure probably can't even be associated with this, but it is 0.001%. I don't even like that is one hepatic failure is 1 out of 100,000 people. So yeah, we're being transparent here. Like that's been described, but it's that rare. So,
that was a long growl.
Something else people will see. Do you have any thoughts about the liver injury?
No. I mean, again, weigh your risk. There's a 1 in 100,000 chance that you'll have some sort of injury to your liver. But there's a higher chance that if you don't take your statin, you'll have a heart attack or a stroke or die.
So this next one actually I think has raised a point of conversation for a lot of people. There has been a described new onset diabetes association with statins. And what I'd like to say to this is to add context to the picture. The increase in risk is modest. I think it already happens in people who have risk factors for diabetes, including those who have and are managing obesity, who are managing an impaired fasting glucose or have insulin resistance already, or people who have metabolic syndrome. To put numbers to it, the risk is about 0.2% per year. So 0.2% per year comes out to be 1 out of 500 people. So that means that 499 people out of 500 every year who are taking a statin will not develop diabetes.
Yeah.
And the odds are that they probably had something going on inside already that was predisposing them to getting diabetes anyway.
Yeah.
Insulin resistance, metabolic syndrome, having obesity. And so what's the thing we've been practicing here with this episode? What are we weighing?
We're weighing the risks of statins. Wait, what did you say it was? 1 in 500 people?
1 in 500 every year.
Okay. Let's weigh your 1 in 500 chance of getting diabetes
This year
from this medication, or keeping your LDL high and dying.
There we go.
Which one? You're also like, again, like you said, if your LDL is high and you have other risk factors and maybe live a lifestyle that's, I don't know the word I'm looking for.
Not so healthy.
You might be on your way to diabetes anyway, so.
Is it the statin that's going to tip it over?
It's probably not the statin.
Exactly my point.
It's probably the Five Guys cheeseburgers you're eating every week.
There we go. So then there's this other one that I think is interesting. And mind you, all of these are from the New England Journal of Medicine.
Mm-hmm.
I'll clip that and put it in the front. All these side effects listing. Cognitive side effects. There are reports of rare memory or cognition issues. This comes up in the lay media. People are worried about it. And they looked into these with randomized controlled trials and found it to not have a significantly increased risk of statins associated with cognitive side effects. What I will also say is that we have an aging population. Mm-hmm. As people get older, cognitive issues become more prominent and more prevalent. And we will define these terms for you in the future. We will have episodes. I had a great lecture recently that kind of gave me the inspiration to do that. But as people get older, these become more common. More people, as they're older, are on more statins. It is easier to try to pin it on the statin, and I don't think it is. And they looked at this in research and found that it's probably not true.
And okay, so if you get to the point where your doctor sits you down, says, we think it's a good idea for you to take a statin, and if you're kind of looking at these side effects that all have a very minimal chance of happening, and if you don't like them, that's fine. However, if you're at the point where you need to take a statin, I know there are, like the hereditary portion. Sometimes there are things that you can't control,
sure,
no matter how great your lifestyle is. But for the most part, the lifestyle that you've had for the past X amount of years has led you to this point, and the risk associated with that is higher than and more dangerous than these very minimal risks from a statin. Does that make sense?
That makes a lot of
sense.
You
can cut that if that was too harsh, but
So there are other rare side effects that have been mentioned alongside the names of statins, including renal dysfunction, cataracts, tendon rupture, hemorrhagic stroke, interstitial lung disease, and all have not been definitively linked to statins. And so there is a great New England Journal of Medicine article that overall says statins carry a low risk of serious side effects, and the benefits in preventing cardiovascular events generally outweigh the risks. That's not me. That's not Nick. That's the New England Journal of Medicine talking. Mm-hmm. So take that and do what you want with it, because we don't get sponsored by Big Pharma. I don't have a relationship with them.
I wish. We would have so much money. Oh, my God.
Right. But the choice ends up being you, and whether you take the medicine because you see the value in it, or you change your lifestyle because you see the value in it, and then go from there. And this isn't meant to be punitive. This is meant to sort of be a reality check when it comes to all of this, because I wish I could have this detailed of a conversation with everyone who I'm talking to. But it ends up being a little snippet of
here's now you'll have something to refer them to.
You bet I will. And the last point that we'll make today is the importance of sticking with treatment. This is a lifelong process. Honestly, cholesterol management, really, it forever, probably. It doesn't have to always be the medicine. Like, if you make significant changes to your lifestyle and your body, and if you manage your obesity and your BMI is 35 and you get down to 27 and you did that without medication or with medication, then yeah, that's a situation where it's managed, but in a different way. Something that's important, I think we're going to spend a little time talking here about it, is that stopping your treatment will cause your lipid levels to rise, and it will increase your risk of heart attack and stroke that you were protecting with the medicine.
Mm-hmm. So if you don't like taking the medicine, you should make some serious lifestyle changes, because does that happen and you take people off if they've made a big change?
Totally. Yeah. I mean, especially when it comes to the GLPs, or if someone comes back and they're like, I stopped drinking 40 beers on the weekend. I don't smoke anymore. And I went from 280 pounds to 220 pounds. Yeah. If they're on it for primary prevention and which is no one has disease yet, but their risk comes down, I'm open for a conversation about that. But that dramatic lifestyle change to body composition would have to happen. Mm-hmm. And at the end of the day, today we spent a lot of time diving into the statin. I think that was probably the best use of our time and your attention. There are a lot of other medicines that are involved. Frankly, none have the combination of value, affordability, tolerability, and effectiveness as statins. There are other ones out there. Don't get us wrong. They go by different names. They work in different ways. A lot of people are on different medicines. We're not going to talk about them today as to not overwhelm you, but we really wanted to get at the core of balancing. Like, you tell us.
What?
Balancing the risk of...
Oh, yeah. The risk of what will happen to you if you don't make any change, you don't take any medicine, your cholesterol just stays high, maybe gets higher, versus taking a very commonly used and safe medication that has very minimal side effects, or very minimal chance of a side effect, I guess.
Even that
really,
too.
I should say.
Yeah.
Right? Like, which one?
Exactly.
Your risk of having like a stroke or dying is higher than if you just take the statin.
Well, and you see this every day, right?
Yeah.
You see devastating things every day.
Mm-hmm.
And
people will just say like, yep, they were non-compliant with their medicine and they had a stroke, and now, in varying degrees of, that's life-changing.
Yeah. And this exact conversation, like, you can even go back to my like personal statement to get into medical school. Like, being able to grab a hold of something before anything happens and knowing that you can do something about it and prevent it.
Or people don't have a primary care doctor, and that's also another big thing. I give my PCP spiel a lot.
You're gonna like marry one, so yeah.
Yeah. Well, it's a lot of primarily African American males. So I think it's a lot of like distrust with the system.
Yeah.
I found, and like what they've told me.
Mm-hmm.
Or they're like scared.
I see that.
Yeah.
I see that a lot.
Like, they're not all bad. Just go.
Yeah. I know. I wish I could take them all. So, in summary, on this very important episode and our culmination of our cardiovascular risk, understanding cholesterol, statins are a great option as a tool if your doctor or whoever's taking care of you thinks that you should use it. And it's proven. It reduces heart attack, stroke, the risk of heart attack, stroke, and death. So if there's something out there, why wouldn't you consider it? But to your point, you led us through that conversation. Lifestyle changes, incredibly important, and should be the first thing, should be the most important thing.
Yeah.
So if you leave this episode, I hope you leave inspired and at least a little pensive that maybe you need to do some reflecting on where you're at. If you're taking the time and you've made it this far in the episode, that maybe you need to take a look in the mirror and see what's going on. So that was a heavy week of this week. That was a heavy episode of Your Checkup. Thank you for coming back, and please share this with a loved one or a neighbor. Seriously, like if you need someone to have an honest conversation that really isn't afraid to look at the side effects and address them, but also recognize the benefit of medications or talk about cholesterol, that's what we're here hoping to do. But hopefully today you were able to learn something for yourself, a loved one, or
a neighbor with high cholesterol, high LDL cholesterol.
Excellent. Please come back for another week of Your Checkup next week. Keep an eye out for any bonus episodes that we may throw out there for you. And most importantly, stay healthy, my friends. Until next time, I'm Ed Dulesky.
I'm Nicole Rufo.
Thank you and goodbye.
Bye.
This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. We explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.